We're now at a very interesting position where we can reflect on the last couple of years, and where 2021 was a year of significant challenges, 2022 was actually a year of change.
2022 was an incredibly busy year, but also a year that we achieved a huge amount.
It's been a challenging 12 to 18 months that I would say, but a lot of things have actually changed for the better.
The commitment of our staff over this period of time has been quite remarkable. There are fabulous stories of staff that were doing things like, arranging weddings for patients. We had volunteers coming onto the ward to support people to write letters.
One of our big focuses has been really bringing together patient and staff experience, and that's absolutely from the perspective that we can't possibly hope to provide the very best care to patients in our community if we don't support staff to thrive and do their very best work. We've listened to staff to really understand what matters most, and similarly with patients in the community, really listening about what are the things that we can be doing better.
As we enter into a new strategic plan cycle, we will need to look at what we've learned through the past, but also what are actually some of the key themes that are actually on the horizon. The strength of our regional partnerships has been a major growth area for us, and this is critical for people living within regional areas. We are actually able to provide specialist care closer to home.
The mental health program has made a very big commitment to the recruitment, retention and utilisation of a paid lived experience workforce. We know that someone that has a lived experience really can shape and support the recovery of someone who's experienced particular challenges in their mental health.
The Alfred has been, I think, incredibly innovative and forward-thinking about how we deal with the patients of the future. One major learning I think that COVID provided for all of us has been the advent of technology to allow us to interact with people remotely.
One of the things we've actually found is that not all patients need to come to the emergency department. We can actually treat some patients very effectively at home. We're looking at how we can run a virtual emergency care model, and we opened today, to the date, a year ago, our virtual emergency department. 1 year later, we've prevented about 10 to 15 patients every day from coming to emergency and providing safe quality care at home. This is just the beginning of what we can do. So next step may actually be to look at how we can manage a short stay ward at home.
We recognise that we can't do it alone. There is absolute benefit in partnering with a range of people that will bring different expertise to the table.
The Paula Fox Melanoma and Cancer Centre is an excellent example of Alfred Health working with state and Commonwealth governments, academic partners such as Monash University, and also philanthropic partners to actually develop a new outstanding service. We will be discovering new knowledge, new ways, innovative ways of treatment, and we'll have the ability to directly translate that into care.
The interaction with the academic sector and research to actually allow this feedback of innovation. So questions that are brought from the hospital system, tested back in the academic university system, and then fed forward again to actually lead to those improvements is one of the, I think, really important strengths of the Alfred.
I have an absolute vision that once we've got enough staff to do all of the work and jobs we need to do, then we can really start to innovate, because we've got time and everyone's got time to think just a little bit differently. Reflective space is really important for people to be able to think about what they're going to do next.
Being forward-thinking, being innovative and allowing changes to have positive outcomes is where we should be sort of facing.
Our vision for Alfred Health is to carry on bringing together patient and staff experience so that in future we become an example of how to do this really well, that we have a workforce that really wants to be here, that is thriving and doing their very best work, and that's shown by excellent experiences and outcomes reported from our patients in the community.
The biggest strength of Alfred Health is a can-do attitude. There's this always let's explore new ways of doing it. I think that's one of the reasons I believe the future here is extremely bright.